at kids and young adults. Parents need to be on the lookout for them too. Synthetic drugs, often sold as incense or bath salts. They're readily available at some convenience stores and on the internet.
There is nothing good about them from a health standpoint at all. But there's clearly a lot of unknowns.
The drugs are mystery mixtures, a cocktail of chemicals. Some are touted as substitutes for marijuana, stimulants, and a new one nicknamed the N-bomb as an alternative to LSD.
Unfortunately, every 6 months or so, something new comes along.
Dr. Timothy Dougherty is a toxicologist and emergency department physician with Lee Memorial Health System.
When we find a trend of phone calls that are coming in, we can send out information nationwide saying, be on the lookout for these type of things, and these are the names that they're using.
As fast as officials can ban one ingredient, another potentially toxic mix takes its place. Used as party drugs, people take them with no idea what they're getting into or the risks they pose.
Short term, we've seen what happens. Their heart rate gets very quick. Their blood pressure rises. They become paranoid. We're seeing them a lot more frequently. We have had to admit people in the hospital and give them medication to calm them down.
The long-term effects are unknown.
I'm sure that these other drugs, especially if they cause the spike in blood pressure and lead to an intracranial bleed or a blood vessel breaking open because of how high the blood pressure is, that's obviously going to be a permanent event.
Synthetic drugs are responsible for a growing number of deaths. The takeaway for parents, these fake substances pose a real danger. For Lee Memorial Health System, I'm Amy Osher.